I am Community Chloe, and welcome to another edition of Her Story RVA. We're back with Urban Baby Beginnings, representing Virginia Maternal Quality Care Alliance. As a recap, UBB is one of the five organizations that makes up MQCA. This evening, we will be discussing the importance of Medicaid and we'll be joined by the Department of Medical Assistance Services, known as DMAS. Tonight, we are joined with founder and executive director of Urban Baby Beginnings, Stephanie Spencer, as she continues to share resources and connect us all to all things Maternal Quality Care Alliance. Thank you. We're like sisters now, Stephanie.
Absolutely. I'm so excited to be back again to talk about something so important to the community. So thanks for having us.
Oh, you're absolutely welcome. And I'm also excited to introduce Marissa Sadler, who is a maternal and women's health analyst at the Department of Medical Assistance Services, DMAS. How you doing?
Thank you. Thank you for having me. I'm well.
Oh, yes. Marissa will be sharing the importance, and this is a big M word, Medicaid, and how DMAS supports the community by spreading awareness about it. So we're going to get started. According to Medicaid.gov, Medicaid provides health coverage to millions of Americans, including eligible low income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by states according to federal requirements. The program is funded jointly by states and the federal government. All right, Stephanie, you know I'm starting the questioning process. We got a hot fire 15. Let's go. Can you share with us how UBB supports Medicaid members?
Sure, absolutely. So, if you all are familiar with our program, we provide support to pregnant and postpartum people up until the age of 2. And our Medicaid members are able to access our services and our doula support services because they are eligible for Medicaid or are uninsured or in need. Probably 90% of our population that we serve at Urban Baby Beginnings are Medicaid members. And so, this is really important for them to know so that they can access our services as well.
Thank you for that. Now, Marissa, what exactly does Medicaid cover when it comes to pregnant related services and or for new moms?
Absolutely. So Medicaid covers a full range of benefits for both mom and baby. And when I say full range, you name it, you think of it, we cover it.
Okay.
So as far as prenatal doctor's visits, your dentist visits are super important as well. Doula services, which is a newer benefit, which came on 2021. Also your delivery services, postpartum care, reproductive health, lactation services, transportation to and from appointments. And so we get a lot of support from our managed care organization. So we have to give them kudos as well. And another important thing is a postpartum care, which I'll talk about in a little bit more in our show today. So thank you.
Oh, thank you, Marissa. Y'all
Mhm.
doing it big, covering everything. In fact, Marissa, how many pregnancy members does Medicaid currently serve, and what are the demographics?
Absolutely. So currently we serve 40,000 expected members within the Commonwealth, and that's a huge range for majority of our members within the NOVA, which is the Northern Virginia area, Central Virginia, and also Tidewater. And that represents the 1 in 3 births in Virginia. So that is pretty huge. And so we want to make sure
Yeah.
within our diverse communities within the Commonwealth what that looks like. And so a breakdown is averaging like 28% members who identify as Black, 61% averaging around whites, and then 6% as far as our Hispanic community. So we serve a wide range, and each of those eligibility groups kind of come from our pregnant individuals for Medicaid, and also serving within our pregnant moms program, which is for the demographic of higher income. So pretty different, but we do serve a wide range in covered services for mom and baby.
So, Marissa, I want you to repeat something real quick. When you broke it down with the demographics, you said about 28% Black mothers
28, yep.
or
28% identify as Black, 61% identify as white, and 6% identify as Hispanic.
hmm, okay. You learn something new every day.
Absolutely.
Now, Stephanie, and we've talked about this several times, are there any current efforts to support postpartum members?
Absolutely. Oh my gosh. So, postpartum coverage actually has expanded to 12 months. in the state of Virginia. And Marissa, you can correct
Wow.
me if I'm wrong, but I believe we were the third, was it the third
Mhm.
state
Yeah.
to actually expand postpartum coverage? And previously, it was only that pregnant women had coverage up to 60 days postpartum. And
Hmm.
so that's really important because not only from the services of pregnancy, moms can now get, primary care. They can continue on with making sure that they're connecting with the providers that were so important during their pregnancy and making sure that they're establishing a good, healthy, continuation of services over time. So we're really proud of that. And I know you're going to pivot to Marissa and she'll talk a little bit more. But for us,
Yeah.
we know that our moms really needed that coverage, and all
Hmm.
of us were really pushing
Yes.
forward. So we were happy when DMAS and the administration and others and CMS really came forward and said, "We know this is important. We're going to make a difference and a change." And so we're really proud of that.
We're talking about the percentages of African American pregnant moms who will need more care.
Yeah.
Absolutely. Can you tell us more about Sisters Keeper, Stephanie?
Yeah. So Sisters Keeper is our group that meets in all of our locations. So we have four. I don't know if I always mention that, but we have four locations, one in Richmond, Petersburg, Norfolk, and Newport News. And
Hmm.
so a mom who is in need of care and support can engage in and enroll in our Sisters Keepers group. And generally, they do that through our outreach efforts. If we're in the hospitals or clinics, or if we're at baby showers, we'll tell people about this. And they don't have to be Medicaid eligible to take advantage of that service, but the intention is to create a social network for mothers to be able to have a safe place to go for themselves and their babies. And what it also allows them to do is to connect with resources such as understanding Medicaid. We did baby massage one time. We've done
Really?
financial planning. And so these Sisters Keepers, which were a model that was actually developed by the moms and influenced by their voices,
Okay.
has really helped them to have a sense of belonging, but also to make sure that, when we're talking to moms, we just have that real talk about, why is it important to make sure our babies are going to our providers' offices and
Yeah.
pediatricians, but also what are the barriers that you have. Let's talk about that as well.
Hmm.
So we're really happy to continue on with those Sisters Keepers groups. And they generally are offered once a month in every location, but our goal is to offer them twice a month everywhere.
Oh, Stephanie, thank you so much for this. This is so important for all of moms and family members, the villages who will watch us tonight. If you are eligible, you need support, please get in touch with UBB. Now, back to you, Marissa. Can you tell us more about how Virginia Medicaid supports the community?
Absolutely. Thank you. So DMAS is definitely doing a lot to support efforts such as Stephanie, what she's doing at Urban Bay Beginnings and some of our other community partnerships. So I think that the main thing is we're catalyzing and we're honing in on lasting relationships
Mhm.
to enhance these maternity care services and the partnerships that we currently have. So a significant portion of our partnerships do revolve and cover with our stakeholder engagement, support with our managed care organizations, as I shared before,
Yeah.
and a lot are led by our governor. So those governor-led initiatives are super important because we focus on the community there. So one engaging effort that we're currently doing now is to support with Partnership for Petersburg. And so as we direct those efforts to improving access to care
Yeah.
and forging, resilient partnerships, that is the main thing, as I shared before, is we want also members to be advocates for themselves. We also want to support the provider. So it's a kind of a touch and go basis with the member, the provider. They can be advocates for themselves. So, and as Stephanie stated there too, we want to make sure that the community voice is heard and we're making an impact of the work that we're doing.
Yeah.
Yeah.
That's good with the Petersburg partnership as well.
Yeah.
Just some of your partnerships, in particular with UBB. Now, I'm going to ask the questions, right? How does someone enroll to receive these services that DMAS provides, Marissa?
Absolutely. So all persons outside of just the pregnant individuals can be in contact with Cover Virginia, which is Cover VA, and that phone number is 1-855-242-8282 for any assistance in enrolling in any pregnancy Medicaid coverage areas there. And you can also contact your local DSS, which is 1-800-855-635-4370 to receive any more information regarding like your benefits and the services and what that looks like based on your eligibility group.
And it's so important to get
Yes.
enrolled. Thank you so much for this wealth of information. This is amazing. Stephanie, how does someone enroll to receive these services through UBB?
So they have two ways they can do it. So they can go online and go to urbanbabybeginnings.org. And there's a button on our website called Refer Now. And they can click on that and they can refer. They can refer themselves. They can help a friend. We are never going to turn anyone away from making a referral in if they need the help. Secondarily, we have a 24/7 line. And it's in English and Spanish. So moms can call in and they will also direct them on what to do, or they'll get them to someone who will help walk them through the referral process. So
Mhm.
we want people to know, we have a plethora of means of being able to enroll in services, and don't think twice about pushing that button or getting in touch with us.
Yeah. This is good stuff, Stephanie. Thank you again. I just can't thank you enough because I want all of us women to have healthy pregnancies and don't feel like they're alone. So, Marissa, when you think about Medicaid, it's like it's straight to the point and quick. And now you support doulas and also talk to us about your efforts with postpartum services. So, you're recognizing that as a real issue when it comes to our
Absolutely.
women.
Yeah. So,
Good
Gita,
job.
we noticed that it is a need, and as
Yes.
Stephanie shared before, we're the third state, so we're super excited about that to be ahead of the game and understanding what that needs looks like for our members within the Commonwealth. So, as Stephanie also stated before the 12 months postpartum coverage, we were only covering 60 days, and so this new eligibility period definitely applies, as I stated before, for pregnant individuals who are enrolled in Medicaid, but it also gives them more time to kind of get the services that they need. And as I shared before, we definitely want them to be advocates for themselves. And so these individuals still maintain their enrollment and coverage throughout their pregnancy for the 12 months and even after for childbirth. And so this eligibility does not change based on income. And so the cool part about this is I shared before, these benefits don't change. So members are still able to receive dental benefits, mental health services, treatment for
Wow.
substance use disorder, and
Yes.
birth control, and so much more. So this is super awesome. We're ahead of the
Yes.
game and doing great work with this since it's already been implemented. And so super excited that members are now able to receive this full coverage of benefits.
This is huge.
Absolutely.
We've been talking about this for a number of years. Where do we place our mothers who have mental health issues? Where do our mothers with substance use issues go? You know what they do? They go away separately and privately and have our babies that have issues that we can help and support. So thank you, DMAS. And I want to thank you, UBB. And speaking of UBB, Stephanie, how does UBB priorities support women across all spectrums?
Ooh, so I think the biggest thing that we always tell people is that you have a sense of belonging regardless of where you are in your pregnancy, whether it be
Yeah.
postpartum or your baby, through UBB. And we prioritize women, we prioritize babies because we believe that the services and supports that are necessary they're under resourced. And so we have to have some way of
Yeah.
bringing people into spaces where they have a sense of belonging. I think the other thing that we're trying to prioritize is information. So, we've been around with you all for quite some time
Yeah.
now, and every time we come out, we're trying to share more information with
Hmm.
community, and that is a huge priority because one of the things that moms continuously say is, people are telling me that there's this resource out here. I don't know where it is. I can't
Yeah.
find it. Right. And so we
Yeah.
want to be sure that, the community's voices are uplifted in this and that we're doing what we can to make sure that we're keeping people safe. And part of that process is making sure that folks are aware of Medicaid and the benefits. So then that way, not only can they apply early, but also they can use the benefit to their fullest advantage, because I don't think moms and families know all of the benefits because things have changed.
Yeah.
So this is a
Yeah.
priority for us.
Yeah.
Yeah. And Marissa pretty much touched on the benefits and the services that they are supporting. And it's vast. It's like it's like all of the benefits that you're supporting is like things that you talk about in the support group, and it's in real time. Great job, DMAS. What is now, Stephanie, you and all of these acronyms, what is SDOH and how does UBB support SDOH efforts for community members?
It's social determinants of health, and we use that, and shame on us because people are like, what are
What
you
is
talking about?
that's
And
dope.
we're talking about,
That's
you
dope.
know, yeah, where you live, work, and play. Is there something that is accessible to
Yeah.
you to help you
Mhm.
to live your best life? So things such as good transportation, good medical care, housing, mental health services. I mean, we can keep going down the line. Pregnancy care. Do you have an accessible provider? Do you have a UBB? These are things that we want people to understand. So when people are engaging with Urban Baby Beginnings, we have care coordinators that are evaluating, similar to how the managed care organizations that Marissa was talking about.
Yeah.
Similarly, we do the same. Just the difference is we have a community led and informed space where people can come and get support. Whereas the managed cares, though they're in community, they also tend to be in these health systems.
Right.
Mhm.
And so how we manage and evaluate moms when they're coming in is we really are listening. What is it that you're experiencing a barrier in? And we put our hive minds together so that we can connect people with those safe quality care and services, whether it be because you need a provider, you need such as a midwife or a OB,
Mhm.
or you're trying to really finagle through housing and you're not sure what to do. Or we have partners that you can connect with, but you need to know who they are. So that's what social determinants of health are. It's really, we know that when people aren't cared for in all aspects holistically, that we can have worse outcomes, right? Because if we don't
Yeah.
have a healthy environment for our babies to grow up in, if we don't have the right provider that's helping provide services to us, if we can't get there because there's no transportation that's accessible
Mhm.
to us, it leads to poor outcomes. And so that's why we focus on that. And that's why we want communities to know at the forefront, the first thing is making sure that you have your access to your insurance and Medicaid, and secondarily, that you know who trusted community partners are so you can get that help and
Yeah.
get connected in the
Yeah.
right way.
And that's where we come in with information. So I'm pretty sure I'm going to ask the question, Marissa over at DMAS, how do you Medicaid address SDOH? And you got a big answer from me. I already know. Okay.
Similar to
Well,
what Stephanie said, I think the main thing too is we want to improve the health and wellness for mom and baby, and so alleviating a lot of those barriers is the main thing that Stephanie said. And so we do a lot of work with our managed care organization, so we have to give them their props once again. And so they provide a lot of added benefits and incentive services for mom and baby, and for the family just as a whole, because we know the family is a catalyst of everything to help support mom. It's a community. And so offering meal services for mom, any transportation to and from, as we know that can be a barrier depending on your area. And if you're in a rural area or a desert, a food desert, the meal services definitely come in hand. And so adult vision and care is also supported for mom and baby. And so just reducing some of those maternal mortality rates is one thing that we look at. And the data definitely speaks for itself and tells a story. So as we're looking at our data, we're seeing where the needs are and how we can support our members. And as Stephanie said before, the community voices are what are helping to set this platform and set the
yes.
stage for us to improve wellness. So we want them to come in, we want them to share what's working, what's not working. And so I think as we continue to improve these services and care, everything that's on this platform currently, we can do better. We can make
Yeah.
improvements for this. And so I think that's why that is the main thing of what we're doing. And that's what our commitment is with Medicaid, of enhancing maternal health outcomes and beyond as well.
Yeah. So amazing.
Yeah.
And for more information, if folks want to learn more about Medicaid, they can go to Cover VA. Marissa?
Correct. So we have social media platforms. Medicaid does have social media platforms, and
Medicaid as a social media
we have social
platform.
media. So who does not have their phone in their hand? And so we currently utilize Instagram, Facebook, and what is now X, which used to be Twitter.
Yeah.
Each of those platforms are with Cover Virginia. So cover at cover underscore VA for Instagram, at Cover Virginia for Facebook, and then at Cover VA for Twitter. So we're happy to utilize these platforms, number one, because this helps to keep our members informed. And we want to make it a safe space for them to see what's going on. And as we're receiving information, we do share it with them as well.
Okay, I see y'all showing out
Yeah.
DMAS. Marissa Sadler, thank you so much for joining us.
Thank
And
you.
Stephanie with Urban Baby Beginnings, thank you for the sponsorship. The Virginia Neonatal, Prenatal, Collaborative, and Maternal Quality Care Alliance. I want to thank you again. I can't thank you enough. This is the final sponsored episode by VNPC, and we want to let you know we're going to come back. We're going to come back in April and we have more information. We learned a lot today. There are 40,000 expectant mothers in Virginia, right? Right, Marissa? I'm
You're
listening,
right.
right?
Yeah.
And 28% are utilizing services by Medicaid who are Black, and 61% of pregnant mothers are white, and 6% Hispanic. Now, I'm willing to bet you that more African American moms need those services as well. So please, please get all of the information that you need. Stephanie with Urban Baby Beginnings and Marissa Sadler with DMAS. God bless you. We out.
Thank you.